Hi, I'm Dr. Nirbhay Parashar with Pediatric Cardiology at Lebanon Children's Hospital.
My name is Morgan Mahan, and I work with our community outreach team here at Lebanon Children's Hospital. I'm the pediatric nurse practitioner for our mobile medical unit.
Well, I got vaccinated because coronavirus is a disease that was raging through the America at that time, as well as the world. It's a pandemic, and the only good defense mechanism we have against it is the vaccine. So prevention, as we all know, is better than cure, and this is the best preventative measure.
So I received my COVID vaccine in January of this year, and it was a simple yes for me. I got vaccinated because I wanted to protect my family and my friends. I have immunocompromised family members that I want to be around. I have a 2-year-old daughter at home that I want to protect, and as a community healthcare provider, it was a must for me.
So I've had a chance to manage a lot of kids, unfortunately, who have had COVID or are suffering from consequences after having COVID. The sickness, morbidity, and mortality that is associated with it is real. We see thousands and thousands of people who have died, unfortunately, from this pandemic. We have taken care of kids who sometimes do not get sick initially with the COVID-19 itself. Sometimes they don't even know that they had been exposed, and later on they get the MIS-C, which is a disease that happens about a month or so after having the initial COVID infection.
So as far as becoming vaccinated, I know there's a lot of hesitancy and a lot of questions, especially coming from parents, regarding whether or not to vaccinate your children with the COVID vaccine. We have research, we have viewed the data. It is very promising, and we are excited to have this option to protect our kids throughout this pandemic. I personally am awaiting to be able to vaccinate my 2-year-old, and I know the time is coming. I'm waiting on the data so that she can have that extra protection measure as well.
So as we know now, COVID vaccine is available for kids who are 5 and over, and we recommend that all children should get vaccinated who are eligible for it. Taking this vaccination is important for whoever is eligible for it. We see daily in hospitals, we get numbers about the patients who have been hospitalized with COVID, and we see a glaring difference in the number of patients who are hospitalized or in the ICU or intubated with COVID between the ones who are vaccinated and ones who are not. For example, just any day we can take over the last week, about 95% of the patients who are hospitalized are unvaccinated. And out of that, if you look at the ICU patients, most of them are unvaccinated. And of those intubated, maybe 1 in 40 or 50 are the ones who have been vaccinated, versus most are unvaccinated. So the most deadliest complications from COVID-19 are happening to people who are unvaccinated. So I would urge everybody who is eligible to try and get vaccinated. And if you have questions, we are here to answer them for you.
If you have any questions, if you're hesitant, if you're on the fence, please reach out to your local pediatrician, your local family doctor. Have these conversations and discussions in person with a medical provider that you trust. That way you know that you are gaining reliable information, and then make an educated decision based on that discussion that you had.